Many people are wearing braces or retainers or Invisalign today and want to know the best way to keep their teeth healthy while they're undergoing this treatment. So the first thing I'm going to recommend, though it may be too late, is to do a little evaluation before you begin. If you're contemplating braces, I would suggest you go on some forums online and look at the comments of people. Find out some of the downsides of wearing braces, what might happen to you. To be forewarned is a good thing in this situation. Now, I'm not against straightening teeth. I think it's wonderful, and I'm all about trying to keep baby teeth, so we don't extract them too soon, that we allow permanent teeth to erupt in a nice line. All of that is wonderful, but every now and again, people are not happy with their teeth, and we want everyone to be as happy as they can be with the look of their smile. I totally get that. But be aware there is a lot of marketing and a lot of marketing money behind the push to have you straighten your teeth. And if you are finding that your teeth have moved, I had a lady the other day, she is over 60 years old, and telling me that her teeth moved, and that's why they've crowded, and she wants now to put should she wear braces or get Invisalign. My first question, if you are an older adult and your teeth are moving, find out why they are moving. Before you go to an orthodontist or you go to a cosmetic dentist to find out how to straighten your teeth, I believe if your teeth are moving, it would indicate that your gum attachment isn't healthy, that you may have lost bone around your teeth, and that your teeth are moving because you have periodontal disease. And this is one of the concerns when you wear braces, no matter whether you're a teenager or later in life, or an adult somewhere in those middle years. The biggest concern I would have for you is the health of your gums and the bone around the teeth and the tooth roots themselves. And the hazards you need to think about are if an orthodontist moves your teeth too quickly, and this has happened to one of my own daughters. Her teeth were moved too fast, so the roots of these teeth, when she was a child, never developed properly. And this was why later in life, when she had trauma to them and the nerve died, that it was an incredible problem because it wasn't a normally formed root. The root had become shortened and not formed properly because of the speed at which her teeth were moved at a very young age. Now, the other thing that I worry about is that the actual gum tissue around teeth may be traumatized, again, by tooth movements or by putting the tooth in a position where the tooth is not working any longer. It's no longer in contact with the tooth underneath it. Teeth normally bite against upper tooth will bite against the lower tooth. And the story was, actually, I got involved in orthodontic treatments in England in the 1970s because there was no specialty of orthodontics for children. And I went to get special training. And then when I moved to America, I became a pediatric specialist in America and did further training in orthodontics. So I was really shocked when one of my younger children had orthodontic work done, and her teeth were moved, but not moved into a stable position. They had moved her teeth so she had this beautiful wide smile, but there was nothing holding the teeth there. The only way to keep her teeth in that order was to either wear a retainer for the rest of her life or to put a metal bar behind the teeth to keep them in that space. And my concern with this new concept of orthodontic movement, I'm seeing people who had that done 20 years ago, and these teeth that haven't really had any work to do for 20 years except smile at the public, the gums are not healthy around those teeth. And my question to periodontists and anyone in the orthodontic world is it possible that by moving teeth out of occlusion, this biting work that they're supposed to do, does this end up resulting in gum recession and the loss of gum tissue 20 years from then. And I think you need to be really clear where you're going when you go to an orthodontist and ask for a smile makeover. You want to make sure that your teeth don't end up not useful. They need to be used in order to keep the bone and the gums strong. So usually, if you're wanting to correct your teeth, there are 3 things I would say you must consider. The health of your mouth, the state of your teeth. Do you have a lot of decay? Have you had a lot of decay? Do you have gingivitis, bleeding gums, gum disease? Because all of those things, in my opinion, should be corrected and cured before you even contemplate making life more difficult with retainers or with braces or with Invisalign. All of those things are going to make it harder for you to keep your teeth healthy and clean. And I think it is a huge mistake to put braces on children's teeth when they are still prone to cavities. Because the cavity, the demineralization and the damage to teeth will occur under and around these braces. And you may have heard of scarring. This is a white spot on a tooth that occurs because the mouth wasn't healthy while the braces were wrapped around the teeth, and there have become little marks, areas where the tooth has lost minerals, sometimes to the point of becoming a cavity. I've seen children with braces on and the cavities were all around the brace brackets. This is devastating. This is terrible. And so getting mouth healthy prior to any orthodontic work would, to me, be an absolute priority. And I would, of course, recommend xylitol. Great toothbrushing be taught and learned, and use of the products that I recommend. My Complete Mouth Care System does a beautiful job of cleaning by swishing liquids around the mouth rather than trying to do it mechanically with lengths of string, which, in my opinion, it's insane when you have braces and difficult teeth that are crowded to try to do that. Now, how do you cope when you are doing Invisalign with eating and drinking? Well, it's actually good, I believe, because you need to stop eating and drinking between meals, which would be my recommendation. You would take your retainer or this Invisalign equipment out of your mouth and clean it after every meal. You'll probably eat without it, and then wash your teeth, at least with water and maybe some xylitol. Xylitol gum would be good in that situation. And clean your retainer by washing it. And then when you put it back in, your mouth would be clean. It would have xylitol that would have stimulated a flow of good saliva in your mouth. And then you would replace your Invisalign or your retainer. To clean that retainer, if you go online, you will be told that the best thing you can do is to use the crystals and the ultrasonic cleaners that are provided by the companies that make these retainers. That's an expensive way to go about it, and obviously it's marketed as the ideal. In my opinion, I have always had great success with a small pea-size amount of the $1.95 Crest Cavity Protection toothpaste and 1 drop of Cool Mint Listerine to brush the retainer and clean all the particles off it. And once it's been cleaned with that mixture of a drop of Listerine, Cool Mint Listerine with the Crest Cavity Protection toothpaste, then I would rinse that off. So you're not soaking this retainer in anything. You're not soaking it in Listerine or sort of smearing a lot of toothpaste over it. That's unnecessary. I would recommend, however, that you use a specific toothbrush designated for cleaning your retainer, and you do not use that toothbrush for your teeth. I recommend some very high-end manual toothbrushes to clean teeth. I would recommend you find some cheap dollar toothbrush at the grocery store for cleaning your retainer. It really doesn't matter like it matters which kind of brush you use to clean your gums and massage them and clean your teeth. So Don't soak your retainer in anything. Don't use boiling water on your retainer or you can warp it. And you can, of course, use the crystals and the ultrasonic. I see no reason, if you want to spend the money, that is what they recommend. But personally, I have always told people they can do a really great job by simply using a specific designated toothbrush, a little bit of toothpaste, and a drop of Listerine, not dousing the retainer in anything, because we don't want to change either the chemical makeup of the retainer or stain it in any way. And you won't if you do it very gently with just small amounts and rinse them right off. So keeping your teeth healthy is all about keeping them clean. Xylitol is an incredibly useful product to help you through. But I would suggest to you that you do, at this point, if you're in retainers, go regularly to all your appointments that you should go to. Ask for pictures. If you can get pictures, particularly, and if you're not getting them taken professionally, take them yourself. And make sure that you monitor any kind of gum recession that you see, either lower anteriors, often a problem, upper anteriors, another problem, on the sides of teeth, a problem. And check if you're getting recession, take a picture, ask questions, don't give up. Keep asking. It is not you that is brushing your gums away. Something else is going on, and you want to stop that something as soon as you possibly can. Don't let recession be such a problem. I have helped somebody who was told they were going to lose all their teeth after orthodontists. They had done this orthodontic work, moved their teeth out of occlusion, developed gum recession, and during a period of extreme stress as well that coincided, this young man got to the point where he was told by a periodontist he was going to now lose all his teeth. And he was less than 50 years old. He was younger than 50. So really pay attention to the health of your gums, ask a lot of questions, go online and visit forums with others who have worked with their own mouth health and these Invisalign and retainers, so that you can truly see the truth. Because everybody will want to sell you Invisalign. And I do believe you should have 2 or 3 opinions, 2 or 3 suggestions for how to correct any crowding of your teeth, because you might be able to do it today with a good implant that is put in a different position. It could be that you could have some crowns. It could be as simple as some veneers to give you the aesthetics that you want without any of that drama going on behind the scenes. So make sure that you see maybe a good prosthodontist or cosmetic dentist for their advice, an orthodontist for their advice, or maybe 2 orthodontists to ask them how they would approach this. And I would never suggest you do this alone. Moving teeth sounds simple, and it is extremely complicated. And if you do it wrong, you can end up with all kinds of problems. So I wish you to find your way to the smile that makes you happy. And I'm delighted to see that around the world, more and more people are saying perfect straight teeth are not what they're looking for. They're looking for healthy, natural teeth that glimmer and shine and feel good and bite together in the right way, that this artificial line of teeth all lined up that look like a row of chiclets is not any longer it isn't natural. It doesn't look natural. When you see a 77-year-old with those little chiclet teeth, you know they're false. So, consider doing as little as necessary if that makes you happy.